Welcome everyone. Good morning and welcome to the Hertfordshire County Council's Resources and Performance Cabinet Panel. My name is Ralph Sangster, I'm the Chairman of the Committee and Exec Member for Resources and Performance. I'm obliged to read out the following statement. Due to the coronavirus pandemic, the Council will be holding this meeting electronically in accordance with the relevant regulations. Members of the public may also attend this meeting in an electronic capacity, and there is a link on the Council's website for them to do so. Members of the Council are asked to keep their microphones switched off until called to speak, and to switch their microphones off once they have finished speaking. Cameras may be left on throughout the meeting if members wish. If you experience connection or other technical issues, it may help to switch the camera off. Cameras should be switched off if and when speaking in the switched on if and when speaking in the meeting. To indicate a wish to speak, members should use the raise hand function. Use of the meeting chat function is exclusively for voting. At the end of the debate on each item of business, there will be a vote. Members should vote using the meeting chat function by indicating for, against, or abstain. I will declare the result after each vote. We will be taking breaks through the meeting to ensure we don't get cramp or take a break for other reasons. So I'm going to now invite the members of the committee to introduce themselves. Firstly, Judy Billing.
Hello, I'm Judy Billing. I'm the County Councillor for Hitchin North and leader of the Hertfordshire County Council Labour Group.
And Eric Backmaster.
Good morning, yes, Eric Backmaster, and I represent Sawbridgeworth Division.
Frances Button.
Hello there, I'm Frances Button. I represent Rickmansworth East and Oxley Park, which includes Carpenters Park, Oxley Hall and Moore Park, and I'm also Chairman of the Audit Committee.
Bob Deering.
Yes, hello, morning everybody. I'm Bob Deering. I'm the member for the Hertford St Andrew Division. I'm also Vice Chair of this group.
Yeah.
Thank you.
Adam Mitchell.
Hello, I'm Adam Mitchell and I'm the County Councillor for Broadwater and Stevenage.
Richard Smith.
Morning, Richard Smith, County Councillor for the Welling Division.
Sharon Taylor.
Sorry, Chair, I couldn't turn my camera on then for a moment. Good morning, everyone. My name's Sharon Taylor. I'm County Councillor for Bedwell Division in Stevenage, which covers Bedwell, Pingreen and some of Martinswood. And I'm the Labour spokesperson for Resources and Performance.
Andrew Williams.
Good morning, I'm Andrew Williams. I'm a member for Hemel Hempstead East.
Thank you, Andrew. Is Phil with us? Phil Williams? I'm not sure he's joined us yet. So Tim Williams.
Good morning, everybody. It's Councillor Tim Williams here from Stanborough Woodside, which is part of the North Watford area. Thank you. And I'm on the case with Phil Williams. I'll find out.
Okay, thanks, Tim. Paul Zukowski.
Thank you, Chair. My name's Paul Zukowski. I'm the councillor for Hatfield South, and I'm the deputy leader of the Lib Dem group on the County Council.
Thank you, Paul. Apart from the fact that Phil may be an apology, I have no other apologies. This is the point at which I invite members of the committee to disclose any pecuniary or other interests in any of the items which are on the agenda this morning. And if they would wish to do so, now is the time to do it.
Chairman, it's Ken Crofton. I'd very much like to introduce myself, please, if I may.
Sorry, Ken, did I miss you?
Easily
forgotten,
obviously.
Yes, I'm just checking that you're on the list, and you were. I just jumped over you. Sorry, Ken.
A lot of people do that. I'm Ken Crofton. I'm the County Councillor for Hertford Rural Division. Good morning.
Thanks, Ken. Okay, assuming that there are no declarations of interest, the minutes of the last meeting, they were only part one. Are there any issues that members would wish to address on the minutes? If not, could I ask you to just agree them in the chat line, please? Just waiting for confirmation that they all are agreed. Okay, that's fine. Thank you very much. We'll move on to item 2, public petitions. There are no public petitions, so we'll move swiftly on to item 3, which is Hertfordshire County Council's response to the COVID-19 epidemic March update. And I think Alex James is going to be the initial spokesperson on this one. Alex, yours.
Thank you, Chairman, and good morning, panel. Just to introduce myself, I'm Alex James, Head of Corporate Policy, and as is mentioned, introducing this report, which is the next monthly COVID update report, which will go on to Cabinet later this month, as ever covering the key developments in the county and council's response to the pandemic. This month's report covers the period up to the 26th of February, so a period which we know saw a positive reduction in COVID-19 cases across Hertfordshire and indeed the country as a whole, alongside continuing progress with the rollout of the COVID vaccine. This period also saw the publication of the government's roadmap for removing the current lockdown restrictions in a gradual and phased manner. And indeed, since the time of writing this report, we have, of course, also had the budget, which confirmed the continuation of the government's various support schemes until September. In line with this, the report outlines the county's local outbreak board's approach to responding to the gradual easing of restrictions. It also outlines progress made against testing and the rollout of the vaccine, and indeed the continuing programme to open vaccination sites across the county, with Ware Priory being the most recent of those. Clearly this week, as we all know, was a key first step in the roadmap I've just mentioned, with the reopening of schools to all pupils. Although in reality, we know that schools in Hertfordshire, as across the country, have stayed open to provide both key worker and vulnerable children provision throughout. And this report provides an update on the arrangements that were being made in preparation for this week. Likewise, this week sees the introduction of the new care home visiting rules, which allows indoor visiting by a single name visitor for every resident. And the report provides a further update on the situation with Hertfordshire care homes, which are thankfully showing positive progress in both case and mortality reductions after what we know has been a really challenging few months for that sector. The report also provides a further update on the work of the Volunteer and People Assistance Cell, including the adjustments that were made in February following the extensions that were made to those being asked to shield, as well as outlining in more broad terms some of the continued support that's being offered to those in the county who need it. The report, as usual, includes the next monthly COVID impact monitor, and I'll now hand over to Martin Austin, if I may, to say a few words on that.
Thank you, Alex. Good morning, everyone. Martin Orrs, Head of Intelligence. The backdrop to the impact monitor is, of course, the very welcome, quite significant reductions now in COVID case rates, cases, and mercifully deaths as well. Perhaps just add the latest figures. This is as of yesterday. Case rates down by 17.6% compared to the previous week. That case rate reduction just slowing slightly. Again, that's in line with national trends. All districts are down to varying degrees, between 20 and 50%, with the exception this week of Welling Hatfield, which has just gone up slightly. Deaths down, the increase last week, 46 compared to 85 the previous week, but still obviously absolutely horrendous. Pulling out just a few metrics from the report. Mental health referrals, section 1.4 and 5, still well above last year's figures for adult mental health referrals. The picture for children less clear, but obviously with schools shut, one might expect with that pathway shut that that's running at slightly below last year's level, but the service expectation is quite clearly they are expected to rise to meet quite significant pent-up demand. Referrals to adult and children's social care. The predicted surges haven't quite fully materialised yet in adult care or children's social services, although there are early signs now of increases in adult care referrals, both January and February. Various metrics on domestic abuse, domestic violence, 2.7, 8, 9 and 11, and all these measures show figures above last year's levels, but they're not at this stage peaking to the levels that they were at the height of lockdown 1. 3.7, probably mentioned, children looked after, have been reporting now for over a year of continued inexorable increases in children looked after. Able to report that for the first time in January, the figures actually reduced slightly. That is in line with national trends. There's always a bit of a reduction in January, and indeed they have gone up slightly in February to use information, but still not above that sort of benchmark figure of 1,000. That figure currently is in line with our nearest comparator, which is Buckinghamshire. Schools obviously returning this week. Haven't got figures to hand at the moment, but in the run up to post half term, we were running at about 25% in primary attendance, again in line with national trends, and just over 4% in secondaries. And we'll be looking very closely at the figures as they begin to come through beginning of next week on attendance at schools on a daily basis. Able to report that no schools, to my knowledge anyway, closed in the reporting period. Library visits and issues, the number of issues and visits hugely impacted by the current lockdown, and there were further very significant falls in February in terms of visits and issues. Section 5.2, attendance standards. Overall attendance standards have improved, and that's thanks mainly to improvements in second pump attendance, and that's continued in this month as well in February, and it stands above that for the same time last year. Contacts to trading standards we've been reporting for some time are up, and they've gone up further in the latest month. Now stand at about well over a third up on the same time last year. Increase in business advice is what's behind some of that, and slightly fewer consumer complaints, and we expect that pattern, that split to widen, increasing business advice. Pleased to report that in section 7.1, COVID secure risk assessments, we've got 198 delivery points buildings. They have now all been, I'm advised, as of this week, both risk assessed and the COVID secure pledges issued. So probably keep this one metric in for the next monthly report and then take it out as we have now delivered what we needed to deliver. 7.3 redeployment, in terms of responding to service demands, that's still going up. But the bulk of the figure of 70 is actually in adult care. So 60 of the 70, section 7.3, is redeployments into support adult care. Furloughed 7.5. If I'd like to, and perhaps we could just minute it as well, there's actually an error in the figure for which I do apologise. My fault entirely. The figure that's there is 1,459 furloughed. It should be, as at that time, 1,409. It was finger trouble on the data entry. I'm sorry for that. The latest figure has gone down to 1,391, and with schools back this week, that figure will of course go down very significantly. The bulk of those figures being related to Hearts Catering Limited. Death registrations, sadly, as might be expected, a substantial increase in January, 7.8.1. 1,374 was the figure in January, and that's fallen in February in line with the reduction in deaths to 893. Probably just mention traffic as sort of a contextual. It is still down in the round over a quarter, 25.9%. Compared to the baseline period a year ago, but peak volumes are up, which is an indicator of actually more commuting at peak times. Lastly, the VPAC volunteers, section 8.7, further increase in the number of volunteers in February, another 400. And in terms of volunteers deployed, an even bigger increase from just over 7,000 to nearly 8,000 in the month. And lastly, Hearts Help calls made, 8.8, similarly a very substantial increase in the number of calls in February, over another 5,500, taking the figure to over 71,000. I'll leave it there, happy to take questions.
Thank you. Stephen Pillsworth might want to mention the financial section of the report. If you just like to draw our attention to anything in particular there that you think we would wish to know.
Indeed, thank you, Chair. Good morning, everyone. I'm Stephen Pillsworth, Assistant Director of Finance here at the Council. The report contains the usual sections on the financial impact of COVID. You will see the outline level of cost compared to the level of grant we've received, and that does indicate a shortfall of just under £6 million. But panel will hopefully remember that back at your previous meeting, when we brought the overall Q3 monitor that includes not just the COVID impact, but what's happening across the rest of the council, there are some offsetting underspends across the rest of the council. So we're broadly in balance for this financial year. The second part of the finance section, page 29 of the pack, page 9 of the report, starts to look ahead to next financial year. The information here is drawn very much from what we included in the council's integrated plan. Clearly that was published a few months ago and things are certainly developing here. So we're trying to update the forecasts here around what the cost impact will be next year. Certainly it's likely to be higher than we envisaged back when the IP was published. So any capacity, any funding we have in the current financial year available will certainly be needed in next financial year. And then just lastly, the rest of the section does have the breakdown of the various sources of funding the council's received, but also specifically outlines those that come to the county council but are held on behalf of partners such as the Outbreak Management Fund. And there's some summary information there as to how those are managed with other councils and some of the areas that is being spent on. So thank you, and happy to take any questions alongside colleagues.
Thank you, Steve. I see Paul Zakowski has the first question.
Well, I have one particular question, but I've got two things to note as well. And I mentioned these to officers yesterday. They confirmed that in page 32, 715, there are 3 bullet points on that in that section. Is it 3 bullet points or is it 4? 4 bullet points. The second bullet point should read contact tracing support, not contract. The second correction was in the appendix, page 39, and it was, we're looking at the COVID-related deaths, and the dialogue in that says total registered deaths this calendar year, and Martin confirmed that it was in fact an entire year from this point backwards, not this calendar year, because obviously that'd be a rather different report if it was the case. Other than that, I mean, I think the report is excellent and very useful in terms of understanding what's going on. There is one further thing that I neglected to mention in our briefing yesterday that I wanted to just raise and question Martin about, and that's the final bullet point of that section 1.2. So it's in fact on page 40, and it says in 2020 the majority of excess deaths in Hertfordshire were due to COVID-19. Now I'm challenging that because as somebody who's done quite a bit of sort of demographics and stats and stuff, my understanding is that there are no other known significant factors other than COVID-19. So there is a reasonable assumption that excess deaths are probably all down to COVID-19, although direct and indirect impacts of COVID-19 would be the difference there. So I think what you perhaps, I'm suggesting that perhaps what that should say were due to COVID-19 positive deaths within 28 days of a positive test. And I think that is actually what that means. But I just wanted you to confirm that my understanding of that is correct, and to, you know, let the others know about that as well.
Martin, perhaps you could comment on that one.
Yeah, I completely agree. That's probably a bit too shorthand and could potentially be misleading. So we will extend that. I will just check it with my public health colleagues for absolute completeness. And we'll just extend the definition there so there's no confusion over what we're talking about. Thank you for that.
Thank you, Paul. Thank you, Martin. Tim Williams has a question.
Thank you, Ralph. I just wanted to come back to Martin just in regards to the sort of the mental health referrals, the mental health and wellbeing. Again, I know it's quite high for adults at the moment, and if anything, there could be sort of concerns on the children's mental health at the moment. I do understand from local contacts with schools just going back this week that basically outside the sort of the student welfare office, there's queues of students who want to actually see the school counsellors and the welfare situation. I also heard last night from our local women's centre about lots of referrals coming to them regarding sort of children who have witnessed sort of domestic abuse because of lockdown or being contained up. So yeah, I just basically questioned, and I know I raised it at the last meeting, and basically I understand sort of it's been referred to children's services, adult care services, and also of course public health. But yeah, what is the situation? I just see the after effects of COVID on mental health and well-being is going to be quite long lasting. So as the relevant public health authority, what are we doing about it?
I'm not sure. So Martin, would you just like to reference the statistics and the metrics? I'm not sure you're in a position to dictate how we're going to respond to it. But you might be able to enlighten us on the metrics.
Yeah, in terms of the metrics, I think there's an indication in the commentary. We're a bit slightly concerned that the metrics are understating the current position in terms of children. That's due to ongoing disruption in the reporting process between Hearts Partnership, Foundation Trust, Hearts Community Trust, and other NHS providers. So I think we've acknowledged that anecdotally the demand is well up, and if all the data was in the system, we would probably already show an increase. And there's little doubt there's enormous pent-up demand coming through, and with schools back, that will probably bring that out. But you're quite right, Ralph. I certainly wouldn't want to, and cannot, and won't comment on how that's been handled with children's services. I think we've referred it back to them, but I don't know if Alex can help me out on that one.
Yes, Martin, thank you. Yes, as already mentioned, it was mentioned at the previous panel, and we have referred, I think in particular in regards to homeschooling, but I think quite rightly it's a much broader issue than that, and certainly we have referred that in terms of this panel's comments to officers both in children's services and public health, and yeah, as you can probably imagine, they are considering their how they're going to sort of bring that through their own panel structures, but it's a very fair point, and I know clearly something that colleagues will be able to respond to, but it's not something that I've got any particular detail at this moment in time.
Thanks, Alex. I think from a perspective of the resources and performance panel, what we perhaps could mention, and I'm going to ask Stephen Pillsworth if he might make a comment on this, as to what funding has been made available to respond to this particular issue going forward, and where within the IP there are funding available for the various service departments to seek funding to support them.
There are a range of areas within IP where we've made provision for COVID generally, and you'll see some of that referenced within the sections I was drawing attention to in the report, pages 29 of the pack, page 9 of that report. So all COVID related issues can be a call on those funds. There are also some more specific related elements that are linked to some of the areas we've been questioning that were quoted and confirmed in IP. So very specifically, I know public health colleagues are using £1.5 million from the accumulated grant funds they have to help target some of those specific areas we are talking about. And then more broadly, there was the budget established, £5.5 million next year, and then £2 million in the years after that, around targeting some of the aspects of inequality arising from COVID and other areas. Plans for that are still being finalised, but that can be used quite widely, and indeed no reason why it shouldn't be used for some of the areas being suggested.
Thank you, Stephen. Judy, you have a question.
I did, but I thought Sharon was long before me, actually. But
I'm merely going by the hands up I've got on my attendance list. So okay, I've got Sharon. Sharon is okay. Sharon has now raised her hand, but you've taken yours down. So, do you want to ask your question?
Yes, I will. It's just about drawing together what we know is going on. So I'm linking this issue about. Sorry, I've just realised I didn't have my camera on. I'm linking this issue about extraordinary mental health needs and referral for all the reasons that have already been stated, so I don't need to repeat them all, with the strategic response and the coordination group as part of the Resilience Forum, because I see that the coordination group brings together health, the emergency services, local and national government and the military, but we know really for the first time there's an enormous amount of mental health support and work going on with children and adults in the voluntary sector, far greater than it ever was before. And I just wonder how we're capturing all of that. There's always been the odd group that went into schools to do work with teenagers exploring issues. There's always been that sort of stuff. But the amount of work going on in the voluntary sector, which we know about because of their requests for locality funding and things like that, I'm not sure in the structure as it's set out is able to be captured sufficiently. And I just wonder if that could be looked at.
Okay, thanks, Judy. Perhaps, Martin, I'm not sure there's metrics available for us to measure those, but I'm going to ask you if you could just make a comment or two.
Yeah, I think Judy's right. Probably the reason they're not there is because they're so difficult to capture. So what I would definitely undertake to do in response is just to scan that environment, see what we can pull together, check with colleagues in children's services and adult care and other sectors, and just see whether we can at least get some of the picture and then share it through this lens.
Alex, are you hands up to respond to that remark?
Yes, just an observation. I mean, I think it's a very fair point, Judy. I think at least part of what the Community Help Hertfordshire kind of consortium of voluntary sector organisations that's being sort of brought out across the county alongside the VPAC cell is that's one of the things they are seeking to look at. But as you say, there is such a diversity and such a sort of a number of organisations operating on this that I'm not sure quite how far they've got with that. But certainly I think that's one of the things they're seeking to look at.
Thank you very much.
Sharon.
Sorry, Chair, I am struggling a bit with IT this morning, so my apologies. I've had to go back out and in again a couple of times, so my apologies for that. I've got a few points to make on this paper. First of all, thank you very much for a very thorough and detailed paper. These are always really helpful papers to have to summarise where we are at a point in time, so thank you for that. Like Tim Williams, I am concerned about the build-up of things like mental health issues, domestic abuse, safeguarding, and I really support Stephen's approach that while we've got a reduction or maybe an underspend in adult care, that will be needed going forwards to tackle some of those other issues which we will be facing. I think that's the right approach, and that's the appropriate way to tackle this from the point of view of a resources panel, I think, is that we're looking at how we get enough resources to deal with what's going to come down the line. The Hearts leaders were looking yesterday at the Local Outbreak Management Board at the self-isolation payments. It's clear there's a huge difference across the county in the way these are being dealt with, and I think we've got a bit of work to do in terms. Self-isolation is a critical part of managing future outbreaks of the pandemic, and it's absolutely vital that we support people to self-isolate when they need to do so. And it is very clear from some of the stats we've seen in some districts that they're not some people are not doing so. So getting that self-isolation payment mechanism absolutely right is really important for all of us. I just wanted to speak about second vaccination process because there's been some confusion about this across the county. Some people are getting called for second vaccination. Some had their second vaccination appointment when they got their first one. And some people now don't know whether they're supposed to book their second vaccination or whether they're going to get it automatically. And I think that is causing some confusion in parts of the county. And it depends where you had your original vaccination, how the process works. So I think we do need some clarification, and I raised that with I did raise that with officers yesterday, but I think it's important that we all have a look at that. The issue around care homes is still with us, I think, and although we may have an underspend this year, the stability of that sector, of both the funding and the workforce, I think we have to be ever cautious in terms of what is happening in that sector. They've had huge increases in their costs. They're still facing staffing issues, partly because of Brexit, but not just because of that. And I think that's something that while we may have an underspend there this year, I think we've got to keep our eye on that for the future as a resources panel and see how that goes forward. My last point, Chair, is around volunteers. I'm delighted to see how many volunteers have come forward. I think it was 400 more in February, and we have had 6,000 calls to Hearts Help. Those volunteers have done an amazing job, and they are at the vaccination centres with Hearts Help, doing some wonderful stuff. I'm just a little bit concerned that when furlough ends and people go back to their jobs, whether there's going to be enough resource to pick up some of the work that those volunteers are currently doing, and I think that's another thing we just need to keep an eye on. Thank you, Chair.
Thank you, Sharon. I'll take those. I've listed 4 items. Some of them are relevant or have relevant issues in relation to resources, and I'll just go through them. The isolation payments, I believe this has been a fund that has been set up by Public Health. Stephen, you may wish to elaborate a little bit more on how much that is and whether or not you know the criteria by which it's being accessed. The second vaccination issues, I'm not sure resources have a role here. It's clearly Public Health and the Health Scrutiny Panel might be something that would be more appropriate in terms of holding or finding out from the NHS how they're organising that. Care homes, yeah, I think you're absolutely right, Sharon. Care homes are going to be a key battleground, if you wish to call it that way, in terms of maintaining the opportunity to keep them solvent, etc. And I'm sure Stephen can indicate how we've been doing that or what resources have been set aside to do so. And I agree with you entirely on the volunteers issue. And I might ask Scott if he could give us a little bit of information in relation to the arrangements that are being made to maintain the vaccination stations at full strength once we start losing volunteers in the near future. So, Stephen, do you want to take the isolation payments and the care homes, and I'll then pass on to Scott?
Yes, will do, Chair. Yes, thank you, Sharon. Yeah, the issue around the self-isolation support is referenced in 715 in the report. So whereas previously government had been providing the funding into our district councils for people to claim, I think that hasn't been extended, and also there were concerns about actually how difficult it was to access and whether the criteria had been drawn too tightly. So it was agreed on the leaders group, again, county and district represented, that we would use across Hertfordshire £2 million of the Outbreak Management Fund money for our own arrangements that again would be administered by the district councils, given they've got the appropriate processes and arrangements in place. I have to admit, I don't know specifically the new criteria, but I would expect, given the previous comments about how difficult it was for residents to access the government scheme, I'd expect there is some loosening of the criteria with our local scheme, but I'm assuming there rather than knowing definitively. I think Sharon's also quite right to raise the issue around our adult social care providers. Clearly, if you look at the numbers in terms of what we've been spending, adult social care is the biggest area. And we were always clear with those providers right from the start of the pandemic. If you are facing additional costs from staffing, from PPE and other infection control, you can claim that back from us. However, despite that offer, the run rate and the amount we've been paying out is perhaps less than we were expecting. Now, at the moment, we believe a lot of that is because there are other funding streams that have come in during the year, including the Infection Control Fund, a separate grant from government that we've passed straight on to care providers. And also they've been able to access PPE free from the government's portal. So they haven't been claiming cost of that from us. However, both of those run out early next year. So we do anticipate that those care providers will continue to face significant challenges next year, but actually probably there will be more coming to the county council for that support than through the other areas. So I think it's absolutely critical we've got the right level of financial provision in next year so we can continue to support those care providers where they need it.
Thank you, Stephen. Scott, could you perhaps give us an indication of where we might be on our vaccination centres and the manning of them, please?
Yep. Thank you, Chair. Yes, I think goes without saying up front that the role that volunteers have played in sort of mobilising our vaccination centres across Hertfordshire has been phenomenal, and we wouldn't be where we are now without that sort of call to arms that our communities have responded to. In relation to going forwards, our team have made sure that we've been working very closely with Herts Community Trust, who are responsible for the rollout of the vaccination programme, and I've put in arrangements with effectively the county council being responsible for all the non-clinical side of the delivery of the vaccination centres. There is funding that's been made available by government from a joint letter provided by the Secretary of State for Health and also for local government, and through that we're able to make effectively claims through our CCGs to government to reimburse us for the costs. We would still hope and still see that volunteers will be a part of that solution going forwards, but again, we shouldn't expect it to be the level that we've had up till now, so in the meantime, but the majority of the costs should be covered by government, but HCC will have the non-clinical responsibility. Thank you, Chair.
Thank you, Scott. Francis, you wanted to ask a question.
Well, I actually wanted to make a comment now because Scott and Stephen have covered quite a lot of what I was going to say, but there will be a question at the end. Thank you so much, gentlemen, the finance team, for managing so well the financial impact of this. I did want to say that I hugely recognise the difficult areas that the county council, the national pressures, the domestic abuse, the mental health issues, and I do think the county council has managed those as well as they possibly could, given the enormous pressures and also on people who've got financial and economic problems. I think I do want to praise what the county council has achieved in terms of putting on extra transport to help the children going back to school, thank goodness for that, and the lunch facilities for children who qualify under the free school meals aspect. The volunteers, I don't think you're going to find volunteers drying up. I've been volunteering locally as a traffic marshal, and getting a slot was difficult because everybody who has signed up is desperate to be out there doing things. I wanted to praise very much not just the working that we've done with the county council, with the NHS in order to get the vaccinations up and running, but the those people, the asymptotic, oh crikey, what's it called? The people who are not showing symptoms.
Asymptomatic.
Exactly, not asymptotic, asymptomatic. Sorry, mathematics. I've been involved in having 2 pop-up testing centres near me. The county council has been amazing and looking at areas and working with volunteers to put these up. One has been at a local independent school, a Merchant Taylor school. One has been at a community centre. People contacted me and said, hey, do you want to use my facilities? The county council has moved so fast to enable these local things. So are we going to have some data on this in the future in terms of how incredibly well the county council has supported the NHS in arranging the testing and also the vaccinations? I have to say, Sharon picked up second vaccinations. The volunteering I did was all for second vaccinations in Bushy, and it was brilliant. It was Zimmer frames, wheelchairs, it was walking sticks. All of the drivers were coming in saying, I've got a blue badge, and we were saying, yes, we all have. We'll find you somewhere to park. People were cheerful, they were happy, they were waving on the way out. So thank you, County Council, for all of the work you've done. And if we could have some data in due course on the pressure and the success in that area, I think that would be really helpful.
Thank you, Francis. Martin, I think we discussed this at the briefing meeting when we were concerned that we wanted to measure the ability of the county to push forward on its second vaccination programme. Perhaps you could give us some indications as when that might be available.
Yeah, certainly. The current situation is we're now in the 2nd week where there is data becoming available nationally on a consistent basis that I think we can trust, indicating volumes of first doses at district level by Hertfordshire. Previously, it had just been at CCG level, which wasn't exclusively Hertfordshire. So we're beginning to get, I think, a fairly reliable data feed that we'll start publishing and will definitely be including, and through the briefing said we would, in the upcoming COVID reports, plus publishing them more generally. I have followed up the query about second doses. That isn't available yet nationally, and I haven't got a timeline when it will be, but I think my judgment, if I could share it with you in the next couple of weeks, that will be becoming available at county level at least. I'm not sure about district level at this stage. So the pattern really is over time increasing granularity of the data. I won't go into it here, but there will be some caveats about some of the vaccination data because it's based on where people are registered with their GP as opposed to where they get the jab in the arm. So it is still a bit of a proxy, but it does give you an idea of how we're progressing. It is split by age groups, by the priority groups, so there's a wealth of data there which we're now confident to bring into the public domain.
Thank you, Martin. I'm sure the next iteration of the report you'll include as much as you can. Thank you. I don't see any other questions, so the recommendation on the order sheet is the panel is asked to recommend to Cabinet that it considers the notes and contents of the report. So in chat, could you indicate your agreement to that recommendation or otherwise, please? Thank you. I think we have confirmation that that's agreed. Thank you, gentlemen. And we'll move on to item 4. This is the approval of the Council's External Diversity and Inclusion Strategy 21-24. And Faisal Hakimi is going to be presenting this one. So Faisal, over to you.
Thank you, Chairman, and good morning. So my name is Faisal Hakim. I'm the Corporate Equality and Diversity Manager. So I will briefly outline the report and the work that's gone into the report and next steps as well. So as you will see, this is our proposal for our external diversity and inclusion strategy for 2021 to 2024. So it's a 4-year strategy. We know Hertfordshire is a diverse place to live and work, and our county's demographic data broadly reflects people from different backgrounds. As a county council, we're committed to ensuring that we demonstrate equality and diversity in everything we do, and specifically is making our services accessible to everyone and ensuring our policies and practices are anti-discriminatory. So this 4-year strategy sets out how the council will work with our partners and other diverse communities in delivery of inclusive services. The strategy has been developed through extensive consultation with key stakeholder groups and wider public. Attached with the papers, you will see a consultation report. Specifically during the consultation period, which was a 12-week consultation, we consulted on our 3 value systems, as we called them, and also a survey went live as well to receive resident feedback in terms of priorities. Alongside that, we held a number of workshops which were well attended, and we also consulted with our partners and other forums that exist in the county, including the LBGT Partnership, our BAME network, our ACS co-production boards, specifically older people, and we received extensive feedback from Hearts People First as well around learning disabilities. Should add the strategy complements our internal workforce strategy that was developed last year. The strategy also highlights in the vision the current inequalities that have arisen through the pandemic. And we know certain communities have been disproportionately impacted through the pandemic. If I could just briefly touch upon the actual value systems now. So as you will see in the report, we have 3 value systems. First one being connecting with our communities, secondly, be the change, and thirdly is working in partnership for an inclusive Hertfordshire. Under each value system, we have a number of objectives, which we'll be reporting back on a yearly basis in the form of an annual diversity and inclusion report. So the first value system, connecting with our communities, highlights how the County Council's commitment to empower Hertfordshire's communities, ensuring the right mechanisms are in place, and providing a platform for our communities to communicate with the county. Secondly, the value system on Be the Change, it focuses on our leadership role and how the council will further promote and embed a culture of inclusion, acceptance and education in the services that the county council provides. And lastly is working in partnership. So we have a number of partnerships in the county, specifically around diversity and inclusion. We want to strengthen those partnerships. Recently, we've set up the Black and Asian Ethnic Minority Network, and there'll be other partnerships coming on stream as well. I should also add, we will be developing an action plan that will sit below the strategy, and as I mentioned earlier, we'll be reporting back on the action plan on a yearly basis. The strategy will be holding a launch event following the elections. So we're hoping to have a launch event end of June, early July. I'm happy to take any questions, Chairman. Thank you.
Thank you, Faisal. I'm just looking to see who we have in. I've managed to go to the wrong section of my. That's it. Let's get the participants. Yes. Questions from Judy Billing first.
Thank you. And I will put my camera on. Okay. Thank you, Faisal. That's really helpful. There's just one query I have, really. I'm delighted that all this work is happening, but some councils across the country regard the recruitment of councillors themselves as being entirely down to political parties. But other councils have done a great deal of work in terms of Be a Councillor events, encouraging people from a wide range of different backgrounds, quite heavily targeted, to become councillors themselves. Now, I know it's too late for 2021. I suspect most candidates have been selected now. But I wonder whether Hertfordshire County Council, and it's hard for you to say if it's a political decision, might like to be one of those that actually engages with local citizens quite specifically to change the profile of the people who represent the people of Hertfordshire, because we know, we specifically know from the astonishing amount of work that Asif Khan has been doing over this pandemic period, how very limited we are in terms of county councillors from Black and Asian backgrounds, although we have some other minority ethnic backgrounds reasonably well represented. And I just wonder, both politically and from the officer's point of view, whether we might actually, as a county council, decide that that's important enough to, on a non-political basis, seek to make a difference in that arena.
Faisal, do you have a response to that?
Yep, thank you very much, Councillor Billing. And I think our value system 3 around Be the Change is around civic participation, in particularly around our civic institutions and democratic processes. And as you've highlighted, that representation across the political sphere is something for the politicians to have a discussion on. We have set up a reference group and that includes representatives from each of the political parties. We've only had our first meeting, but I'm happy to take your comments to that meeting, Judy, if that's okay.
That's absolutely fine, and I do hope you will, because I think it's so important that out of 78 county councillors, we can't do better than this.
Thank you, Sharon. Sorry, thank
Judy.
you,
I'm
Judy.
I'm the other one. Okay.
I'm looking at Sharon as the next questioner. So
I know we're almost indistinguishable.
Sharon.
Thank you. And first of all, can I say I've worked throughout the pandemic with Faz on the community reassurance group with other Hearts leaders, Linda, Chris Wyatt, Tony Kingsbury. And we don't always see it at the county council so much, but on that group, the incredible work that Faz has done to support our minority communities has and to get messaging out and support the communication with minority groups has been fantastic. So a big thank you to Faz for all the work he's done on that, and for this report, which is excellent. Just adding to what Judy said, one of the reasons that the Labour group has been for the last 4 years recommending that the county council consider having a youth chairman as well as a chairman is that what we found in Stevenage when we introduced the youth mayor provision, we have far more diversity in terms of our communities amongst our youth mayors than we do in our mayoralty, in our full mayoralty. So I think it's a really good way of making sure that those young people from minority groups get an early opportunity to take part in civic life. So that's another recommendation that I'd want to see being taken seriously. My question really is about that. I've got one question and one point. We've done some excellent work on comms through COVID, which has built up as the time's gone on. In the early days, I was a little bit concerned about over-reliance on staff feedback, but I think increasingly with the community COVID champions and all those networks that have been built up, the work's been really, really good. And I think Asif Khan has done a lot of work on this himself. But building on those COVID comms, I think we need to think about going forward how we continue with the webinars, but also a more interactive dialogue with our minority communities, because the disproportionate impact of COVID means there will also be a disproportionate impact those groups may experience a slower progress to recovery. They may experience worse health outcomes in terms of long COVID or mental health, ongoing mental health issues. So I think we need to build on what we've done during the COVID crisis in terms of comms and keep that dialogue going now. And I think that will be really, we've got some great work going on now. So let's build on that for the future. And the second point was around, and I did mention this to Faz the other day, Sandy Walkington is doing a scrutiny of hate crime in the county. And I think some of the outputs from that scrutiny need to be looked at in terms of what's going on for our diversity and inclusion strategy. So it got delayed because the police couldn't attend on the day the original scrutiny was due to be done, but it will be done. And I hope the outcomes of that can be taken into account in the diversity and inclusion strategy. Thank you, Chair.
Thank you, Sharon. Faisal, would you like to respond to that?
Yes, no, happy to. I totally agree, Councillor Taylor, in terms of continuing those comms and engagement with our communities. 2 weeks ago, we held in collaboration with our BAME network, a webinar on black mental health, which was really well attended. We had over just under 300 participants signing up to it, and we're following up with further workshops on that. And I think in terms of that continuous dialogue, we're absolutely committed to that. And just briefly, yes, I was aware of the hate crime scrutiny meeting, and I have a meeting scheduled in with Councillor Walkington next week to discuss ways forward on that as well.
Thanks, Faisal. I think in respect of the comms department, I think this is one of the areas amongst many others that they support throughout the county council, and they do so with a very limited budget and do an exceedingly good job in representing the county council in all sorts of areas, and in particular where it's engaging with stakeholders and residents. Bob Deering.
Thank you very much, Ralph. Hopefully you can distinguish me from Sharon and Judy.
Just about.
Thank you very much. I'm afraid I don't have a question, it's just a statement. And I just want to say that I think this is very important work. I think Faz is doing a great job. I'm glad to be associated with it, and I'm sure this committee is as well. It's very important stuff, and we're heading in the right direction. So thank you very much.
And a question from Paul Zakowski.
Thank you. I just wanted to add my particular thanks to Faisal for the work and support generally for this this strategy and approach. One of the things that I think we do want to say, it's triggered really by the comments that Sharon was making and Julie was making about the kind of outreach and trying to encourage our councillor base to be representative. One of the things that has always been very, very stark to me is the age diversity within the council is, I would say, very much not representative of our communities. And I do think that some effort around that might actually be quite useful and hopefully would encourage some younger people to get involved with this stuff, because you know, when I look around the chamber and I realise that I'm one of the younger people in the chamber, feeling as I do relatively decrepit and old, and I look certainly around my teenage daughters, you know, they're not represented at all in the chamber, and actually that's, I think, quite problematic, and I think that aspect certainly needs a bit of attention too. So I just wanted to raise.
Thank you, Paul. I don't see any other questions. Excuse me. The recommendation is that the panel is invited to recommend to Cabinet that that it approves the Council's proposed external diversity and exclusion strategy for 21-24. Could I ask you if you would indicate in the chat function, please, whether you support or otherwise that recommendation? Okay, I think we've had confirmation that that's agreed. We move on to item 5, which is the annual complaints, compliments and complaints report. And I think Quentin Baker is going to be presenting on this one.
Thanks, Chair. Yes, I'm here to present on this one this morning. I'm going to assume that members of the panel have read and digested the report, so I'm hopefully going to just highlight some of the key issues here. So overall, on the whole, the figures do not indicate any areas of significant change in the receipt of complaints or their outcomes, and that includes the HCC corporate complaints from the and the local government social care ombudsman. And I would just mention this is for the period April 2019 to March 2020 and gives an overview of this. Section 2 of the report contains a summary of the results, and basically we've got 975 corporate complaints were recorded, which is a slight increase on 18-19, where there were 965. In the same period, the LGSCO received 115 complaints regarding HCC, and the majority of these, 75, were either closed after initial inquiry or referred back to HCC for local resolution. During the 1920 period, the LGSCO notified HCC of 33 investigations, and that compares with 28 in the preceding year, and 29 of those 33 were upheld to some extent, which is 88% upheld, and that compares with 66% as the average figure amongst similar authorities. So section 6 deals with the detailed information about the complaints procedures, and I won't go into that in any detail. I'll just take members forward to table 1 on page 3, and that shows an upward trend over the last 3 years. This is the complaints received by area, and it shows helpfully over the last 3 years to show any increases or decreases, which are shown in the arrows there. And the only trends really I pick up on their environment showing an upward trend over the last 3 years, and that's from 83 to 162. And public health also showing a small increase, but there is a particular issue which has given rise to that, and it is a very small number in any case. Moving on to the issue of stage 2 complaints, and this is on paragraph 6.4 of the report. That covers complaints where they've been through the stage 1 process and the complainant isn't satisfied with the outcome, and they want to move it on to the stage 2. And table 5 shows the movement in the number of these. That's table 5, which is on, sorry, the table on page 5 shows that. And it's showing slight mix increases in such as children's services and slight reductions such as the environment, resulting in a slight increase overall. So that's an increase from 80 the preceding year to 91 in 1920. Okay, moving on now to I think response times. Para 6.6 deals with the response times, and they can also be seen in table 2 on page 6, which has the trends of percentage of complaints acknowledged and completed within the time limits stipulated in the policy. And although the percentage of acknowledgements on time increased slightly from 93 to 95%, there was a very slight reduction in the percentage of complaints resolved within the time limits, and that went down from 93 to 91. But again, these are very small movements in the overall scheme of things. Moving on to 6.7, positive news from the compliments, and that's focusing mainly on table 3 at page 7, which covers compliments received. Positive news with the 245 increase, which is a 19% increase over the preceding year, and the customer service centre, which is treated as a separate entity because it deals with so many calls and so on each year, and that received almost 2,000 compliments, which is obviously very impressive. They do take a huge volume of calls. On to section 7, which is the Local Government and Social Care Ombudsman. This is specifically looking at the investigations, complaints that went to the Ombudsman and those that have resulted in investigations. So a slight reduction on 18-19, and there were 72 complaints received by the local by the LGSCO in respect of Hertfordshire, and they were either closed after initial inquiries or referred back for local resolution. There were 33 detailed investigations conducted, resulting in final decisions, of which 29% were upheld to some extent. And the table on page 4, table 4 on page 8 shows the distribution of those amongst the directorates and gives some details of the nature of the findings. Would say that further detail of the findings is contained in Appendix A and B, and that they contain more detail on the finding and the outcome. Just to finish up on section 8, which is about learning from complaints, and just a selection there. Hearts and Fire and Rescue have done some work with their crews to ensure that they leave the sites of where they've been attending, that they leave those sites in a good state when they leave them, and premises as well, which have been the source of some complaints. Environment conducted a review of procedures for installing drop curbs, which had given rise to some complaints. Libraries reviewed the titles they held in periodicals, titles that they hold in libraries from periodicals, as a change had resulted in some complaints. And the coroners have provided training on communication and customer care service skills. So I think that's probably enough from me, and I'm happy to take questions, Chair.
Thanks, Quentin. Just a quick question from me in relation to the way in which we conduct ourselves in these days with remote access to Teams meetings, etc. Is the period in which you're reporting here included any of those period that we've changed our mode of operation, and has there been any complaints or compliments in relation to that?
Well, it's really only a month into that period, so just at the very beginning, and I'm not aware of any complaints that specifically relate to the holding of meetings remotely. No.
Sharon, I haven't given you the opening. Do you want to ask your question?
Yes, thank you. I just wanted to raise an issue around the points about. Thank you, Quentin, by the way. Sorry, I wanted to raise an issue about the highways. It's in paragraph 6.3.4. I do think it would greatly help with some of these issues if there was more information available on the website around how to access dropped curbs, 20-mile-an-hour zones, speeding measures, and so on. I think it's quite. Even I've been on the county council since 2008. I still find it quite a a labyrinthine process to find out how to get those actions taken. And we had an example at our last full council meeting of campaigners who wanted to implement 20-mile-an-hour zones, and I just think there's, we will reduce the some of the complaints about this if we made more information accessible on our website about a clear process for how these things are considered and what you need to do if you want to access that. My second point was around coroner's service 637. I'm pleased to hear that more training on customer care has gone in, because when people approach the coroner's service, it's often at a very incredibly stressful time of their life. And I do think that we're all aware of the impact COVID's had on different services, and it may be partially related to that, but I do think customer care across the piece is really vital, and certainly in that service it is. And just to say that on the registration side, I've found it's an absolutely superb first-class service, very quick and speedy, and needs to be. And I think if coroner's service could be, again, very important, because it is at key points in people's life when they're accessing that, and coroners should similarly be effective and empathetic when dealing with customers. And the last point was around the Hearts Warm at Home. I'm sorry, I've lost my reference for a moment, Chair, but the Hearts Warm at Home programme, which has finished, but is still being promoted by some of our voluntary sector partners. So I just think we need to make sure that when we change schemes like that we let all of our voluntary sector partners know, because it causes a bit of frustration amongst residents when they're given information by a partner and then they come to access the programme and it's not there anymore. It's changed or evolved into a different programme. Thank you, Chair.
Quinton, would you like to respond?
I certainly take on board all of those complaints. All of those comments, and in terms of we'll certainly reflect that and report back to the teams involved. Yeah. Thank you,
Paul Zikowski.
Hi, I'm not sure whether Sharon's response there actually answered one of the two questions that I've got, because I actually wanted to ask about the Hearts Warmer Homes project, because it's referred to in 6.3.6, where it simply says the majority of complaints related to that project. The Warmer Homes project was originally a commissioned service, but ultimately was brought back in-house. Following a limited amount of time, the project was wrapped up and the level of complaints returned to a similar level. And I just wanted a bit of expansion on exactly what was going on there, because the Hearts Warmer Homes service sounds like something that we ought to be doing. And it sounds to me, or comes across from its description, as being related to getting insulation for people who need it and are particularly vulnerable. And I wonder why that project was just ended, and whether there was a continuation of it going forward. So I just wondered if you could fill us in a little bit more about it, because what's said in the report seems very blunt and perhaps a little surprising. So that's the first question. The second question relates to the local government records that you mentioned. So page 165 and records, specific record number 31. If I just go and find it, the description in there is a little alarming, I have to say. There are a number of the because they're very brief and basic are of concern, but number 31 particularly leapt out at me, because it says falsification of care records. Now, this has got to the point where the Ombudsman has investigated, after this complaint will have gone through a two-stage process at the county council and have been, turned down as being a valid complaint on two occasions. And yet the finding of the Ombudsman was that we were at fault because of the falsification of care records, and I'm just a little alarmed about about that particular statement, and I wondered if subsequently we could perhaps get a little bit of an expansion on that, because I assume that you probably don't have that information to hand. But I think I would certainly appreciate a little bit of an expansion on what that refers to.
Thank you, Paul. I think in respect of 6.3.6, which is the warmer homes issue, I think Quentin can probably give you some information in relation to the complaints that were received. I'm not sure he's in a position to identify the policy, the policy issues that surround its continuation or otherwise, but I'll leave him to determine whether he can answer which parts of the question you've raised. And yeah, I mean, under the care records, that's a fairly good comment, and I would be interested in to know what Quentin's response would be. So, Quentin.
Yeah, thanks for that, Chair. And you're right. I can't comment on the policy on the warmer homes thing, but what I will do is I'll certainly flag the Councillor Zukowski's question up to the relevant service, and I've no doubt they will come back with some more information. On the question about the local government social care ombudsman, I'm afraid I don't have the detailed knowledge of that, but I will get that for Councillor Zukowski and get a response to you over how that complaint emerged and was dealt with, and the result that the final result, more detail of the final decision from the local government social care ombudsman.
Thank you, Quentin. And if you could circulate that to everyone on the panel, it would be very helpful.
Yeah.
Eric Buckmaster.
Thank you, Chairman. Yeah, I think based on Sharon's comments earlier, I was prompted to look down the list of complaints by department, and I'm just wondering whether it's not just about providing information, but it's where things don't happen in the way that residents expect them to. So is there an issue around proper expectation setting in addition to providing the correct information the first time? So I just wonder whether it's those two things together.
Quentin?
It sounds like a very sensible comment, yes, one which we will reflect back to highways.
Thank you very much. Just whilst we have you in the frame, so to speak, and my earlier question relating to the way in which we conduct our business nowadays remotely, could you just give us an update on where we are going in respect of the legislation that applies to the conduct of meetings and so forth after the legislation comes to an end?
Yes, of course. As briefly as possible, I'll just run you through the situation. Background is that on the outbreak of the pandemic, and in line with the orthodox or the understanding of the position at the time, some legislation was introduced to enable elected members to attend remotely meetings. As I say, the orthodoxy at the time was that it required, the law required that elected members were physically present in the same location to be officially attending a meeting and therefore be able to vote and so on. And so the Secretary of State very quickly put together some regs to enable remote attendance of councillors at meetings. That legislation was set up in such a way that it had an automatic cessation clause, so it actually ceases to have effect on the 6th of May, and the only way that can be countered is if the Secretary of State initiates primary legislation to do that. That raises a couple of concerns, health and safety concerns. We don't know what the position is going to be on the 6th of May, and we obviously got our most importantly, the AGM coming up in May. So it's not clear as yet as to how safe the environment would be in the council chamber. It's also not clear as yet as to what the prevailing guidance and regulations will be at that time, because currently it wouldn't be. We would have some fairly stringent requirements to comply with to have 78 members in the council chamber, and to be honest, it's probably not possible under the existing provisions to have all 78 councillors in the chamber for council meetings. The other issue is that there's a wider issue of convenience and accessibility has been raised. There seems to have been quite a lot of support for the having the opportunity to remotely attend. I know many members and officers as well are keen to see physical meetings returning, but I think there is an appetite for the ability to be able to attend. So current legislation runs out on 6th of May. The Secretary of State has indicated that they don't have the time in the legislative timetable to make the primary legislation necessary. So there's been quite a lot of head scratching by myself and colleagues around the country about what we're going to do. There's a couple of there are a number of options really, but there's also an application happening. There's a joint application happening by lawyers in local government and the Association of Democratic Services Officers in collaboration with Hertfordshire County Council, where we are applying to the High Court to seek a declaration from the High Court as to the correct and modern interpretation of the provisions which give rise to the understanding that councillors must attend personally, i.e. physically, in the meetings. And really that comes down to 3 words in the 1972 Local Government Act, which is place, meeting and present. And the application that is being made to the High Court is to ask the High Court whether, in light of the developments that we've seen over the last 50 years since that act was enacted, those 3 words could be interpreted in a different way. And this is something that is regularly happening. So courts are regularly asked to adjust their interpretation of legislation. So this is not unusual. And the specialist legal opinion that has been received is that there's about a 50 to 60% chance of this succeeding. But essentially, we're asking the court to say that that a meeting in the 1972 wording would be satisfied with a video meeting, so that will tick that box, and that the presence, being present, would include being present in a virtual space. So on the internet, which of course none of these things were actually in existence in 1972 or could have been comprehended at that time. So that's. I would stress that this is it's an option that we accept, is not guaranteed, and therefore we are making plans for making a plan B. And the plan B really consists of 3 different strands. The first is, and this applies to colleagues as well around the country and also around Hertfordshire. I'm in touch with obviously Hert's heads of legal and also further afield as well. And so there's a mixture of potential to have traditional physical meetings, but just try to, I know some councils are looking for much bigger venues so that they can literally just spread people out 2 meters apart at least, rather than the normal council chamber size. So that's one option. Another option is what we call quorum-only meetings, and you may recall we explored those back last year, prior to the start of the pandemic, and we thought that was going to be an initial option before meetings were turned into fully remote meetings. So that's another potential, and that would mean where each of the meetings, council meeting for instance, when the quorum's around, I think it's 20 something members anyway, and that we would have a proportionate number from each of the political groups up to that quorum level. So it enables business to happen, but it would also enable the spacing of elected members within the existing council chamber. So that's an option. And then there is a further option, which would be to, and this is probably a slightly more extreme option, which is where, and it's quite a technical option, but it's what we're calling officer in consultation with meetings. And this is where we would have an officer technically delegated with the power to make the decisions, but having meetings and virtual attendance would be possible with the elected members. And in essence, the elected members would be advising the officer as to how they felt the officer should exercise their discretion. And you can see, I'm sure, where this is going, as it would be most unlikely for an officer to choose to go against the clear advice given to them by the elected members, and so the decision in effect would result in the same outcome. And that could possibly work in the context of some meetings, perhaps. So those are the three options, Plan B options, that we are considering at the moment, or that are available to us. I've circulated this morning a very short report to group leaders, and we will be looking to consult further. I imagine group leaders will be seeking to consult further with their groups as to the options that they would prefer, and myself and Democratic Services colleagues will then seek to implement whichever option is available. Of course, if the application to the High Court is successful, then it's a very different story, really. We will be able to move to hybrid meetings in that circumstance, and we're already we've been working on the hybrid system, ready for hybrid meetings. So that's what we would switch to if the application to the High Court is successful.
Thank you, Quentin. Judy, you have a question.
It's not really a little question, Chair. Quentin will know, because I have replied to his email this morning to group leaders, that it's not my intention in any way, shape or form to shoot the messenger on this one. But I am frankly outraged that the government hasn't found a way of learning from its experience of the last year when it comes to local democracy. It's quite astonishing that they want to replay history as if this last year didn't exist. And I, for one, and I know many other county councillors will feel the same, cross-party, will be absolutely incandescent with fury if we are limited, precluded from the democratic process, other than by the electorate possibly, which of course it could happen to any of us. That's acceptable. Being precluded by not being allowed to use a technology that we've all learnt to use in the last year seems to me absolutely astonishing, that nobody in government has found a better way of sorting this out in the last year than by going to a High Court for something that has 50 or 60% chance of succeeding. It's madness. It just means that you can't depend on government for the simplest things, and I'm furious about it. And I really tried not to keyboardly shout at Quentin this morning, and I hope it didn't come across like that, but that's how I feel. It's outrageous. You trying to stop me? Am I not carry on being outraged?
If you wish to be outraged, I'm gonna make some comments first.
Okay.
I think, although I'm not outraged in the respect of it, what I am is disappointed because it clearly is not appropriate for the government to not address this issue, and I'm sure we will be making representations to the various authorities to perhaps sort this out if circumstances become unwieldy and inappropriate. So thank you, Quintin, for the update. It's something I've been considering for some time, and I hope the committee were indulgent in terms of us just flexing our position and asking that question, perhaps not necessarily in entirely response to the complaints and compliments report. But thank you. Can I ask the members if they would indicate in chat whether they agree, disagree, or otherwise for the recommendation which the Resources Performance Cabinet Panel give their views on the report and its continuing value and content for future years. So could you indicate that in the chat line, please?
Chairman, are we going to make a comment in the minutes about the issue about continuing with virtual meetings? Because I do think we should be sending something to Cabinet about this so that views of members are made known.
I think given the report has been issued by Quintin to group leaders, I think I would wish that avenue to be explored before putting a recommendation or a comment to Cabinet. It wasn't necessarily in line with the item on the agenda, but I felt it was worth asking the question just to get updated. I've no reason to believe that the group leaders won't have opportunity to recommend to Cabinet or otherwise their thoughts on it in due course.
This group leader just has, Chair. This group leader just has made her views absolutely known.
And I would like you to do that through the group leaders meeting process rather than using an opportunity for some information that's come through, but not necessarily in accordance with the agenda. So I'm being flexible here in allowing us to get the information, but I'm not necessarily flexible enough to hijack one of the items on the agenda just to get a view across to Cabinet. So can I ask you to either agree, disagree, or otherwise in the chat line, please?
Thank you, Ralph.
Just waiting for confirmation. Thank you. I think we've got it agreed. Yes. Okay. Item.
Sorry, Chairman. Sorry, Chair. Are we voting on the compliments and complaints report? Because the abstentions, I'm not sure if they were directed at the compliments and complaints or whether they were directed at the add-on.
We're voting on the compliments and complaints item, which is item 5 on the agenda.
On a point of order, Chair, you asked the county solicitor to report back on that item under this item. You asked him to do that. He has done so, and so I think it's fair. Well, most of us feel very strongly about this. I think it's fair that as it has been raised under that item, that we be allowed to abstain against the report. You called for it to come in under this report. We don't have anywhere else to express our view. You have said you don't want to take a recommendation that this goes forward to Cabinet for consideration. So I think it's fair that we abstain on the item.
You're entitled to abstain if you wish to, Sharon. So Elaine, if they've abstained, they've abstained.
Yeah, I think the point is well made by Sharon, and I'd reiterate it, is that there is an option, I think, on the table to modify the recommendations, and that was rejected by yourself as chair, so we're abstaining from the vote.
That's fine, and you're perfectly entitled to do so, Paul. Can I ask Elaine whether we have sufficient support for the recommendations to agree them?
We do, Ralph. Thank you, and the abstentions will be noted. Thank you.
Thank you very much. Okay, we have agreement on that. We're moving to item 6, which is the Hertfordshire County Council Performance Monitor Q3, and I think Alex is bringing that forward.
Yes, thank you, Chairman. And if you just bear with me a moment, my plan would be to share my screen to show you some quick slides on that. So if you just bear with me a moment, I will endeavour to bring those up as quickly as I can. And I'm hoping that everyone is able to see those slides. And I'll work on that basis. Please do let me know if you can't. So the report in front of you is the Council's overall performance monitor for Q3. So covering the period of October to December of last year's 2020. Perhaps worth noting, as ever, there is an overlap between this report and the COVID impact monitor, clearly covering some similar topics but over different timelines. The COVID impact monitor does cover a more up-to-date period, but without necessarily perhaps the time to give a considered perspective on their implications. These quarterly updates, which we feel continue to fulfil an important role in the ongoing monitoring of the Council's performance, considers an earlier time frame, as I say, but in doing so provides an opportunity for a more reflective and considered commentary. This Q3 period, reflecting that, perhaps saw a mixture of lockdowns alongside periods of more relaxed COVID rules. And as such, the results are perhaps, I would say, a bit of a mixed bag. Some of the results could be seen as showing some signs of recovery, if in course we didn't know that a further period of lockdown was around over the horizon. And as such, I would suggest caution taking those results at face value, especially as there is a concern, as I'll mention, in a range of areas that demand is being suppressed, but will emerge at a later stage in the year, in 2021. First thing to note, though, is with the Public Health Service prioritising the COVID-19 response currently and business as normal public health services being delivered in different ways, it was not felt appropriate to measure these services against these previous performance measures. So in terms of this report, we don't have those indicators being reported against, but this is being looked at so that we can kind of revise those and include something different in future performance reports. So with that being said, I say I'll pick out a few key issues from each area as I've done previously, starting with adult care and health. And I think the first thing to say here is that in Q3, the projected rates for permanent admissions to care homes, both for those over 65 and under 65, continue to show significant reductions in this quarter. Likewise, the percentage of older people at home 91 days after leaving hospital into re-enablement has increased this quarter. And I think it's fair to say that activity in both this and the previous areas, as just mentioned, continue to be significantly impacted by the pandemic, and therefore there is a feeling that this may well rise in all these indicators over the coming quarters. And I probably should say at this point, as the report mentions, the 2019-20 Adult Social Care Outcomes Framework results were also published in this quarter in December. This showed positive scores for Hertfordshire, with the County Council improving in 17 of the indicators, so 74% of those indicators compared to the previous years. And indeed meant that Hertfordshire was outperforming the national and comparator group averages in 16 of those indicators, so 70%. The most improved indicator was overall satisfaction with care and support. Moving on now to children, young people and families. The rate of referrals to specialised children's services did increase this quarter and was now at a similar level to those to what it was the previous year. The number of children subject to a child protection plan also reduced slightly this quarter. However, as highlighted by the red rated risk in the report entitled Impact of COVID-19 Related Issues on Children's Services, a significant spike in referrals and safeguarding is expected at some stage during 2021. So, as I say, it may well be that those don't necessarily, well, I think the belief is that they don't show the true picture as it currently stands, and obviously a further spike is expected in due course. The number of children looked after has continued to increase this quarter. This is due to both an increase in the number of children coming into care, but also a reduction in those exiting compared to sort of previous quarters. So that's due in part to the COVID-related delays in family court hearings, but also it heightened issues with placing those very complex adolescents into permanent placing, something which is always very tricky, but even more tricky in a COVID situation. As Martin has also mentioned in the COVID item earlier, we have seen some slowing of that kind of increase in children looked after, especially in January. So clearly something we'll continue to monitor, both as part of the impact monitor, but also this report as well. Community safety and waste management. Primary, secondary and deliberate fires all reduced this quarter. However, this is balanced to some extent with an increase in primary fire injuries compared to the same time last year. However, overall year-to-date figures in this area are well below the same period from the last year. And the number of traffic collisions attended by the fire service decreased this quarter. As I say, partly I think due to the November lockdown, although it is also worth mentioning an increase was observed following the end of the November lockdown as well. Growth, infrastructure, planning and the economy. Data on the unemployment claimant count did show a slight decrease in claimants this quarter. However, as I'm sure we can all perhaps expect, further increases are expected due both not only to the COVID-19 restrictions currently in place, but clearly the end of furlough in due course. The number of young people not in education, employment or training increased slightly this quarter and indeed once again expected to rise further in coming quarters. The report also mentions the number of net additional homes. This is a yearly indicator, so this is basically the net additional homes provided in 2019-20 year, and it's worth noting this slightly increased slightly compared to the previous year. I think perhaps casting our mind back to that time, but perhaps a positive result, especially given some of the uncertainties around kind of Brexit and sort of the market changes that were taking place at the time. Highways and the environment. The overall performance of the highway service term contract in Q3 was just over 97%, so a slight increase from Q2 and well above the minimum performance requirements of 75%. The percentage of schemes delivered against the Integrated Works programme is slightly below target, but did increase to 76% this quarter. Figures for those killed or seriously injured in a road traffic accident have also shown some welcome reductions in what is clearly a far from normal 2020. Education, libraries and localism. Demand for library online services continues to run at almost twice the level of 2019. In this quarter, overall physical library issues had reached 66% of the level seen in 2019. However, library visits saw a 7.5% decrease in Q3 compared to the previous quarter. And also worth mentioning, perhaps, that the score of the corporate risk on the transfer of libraries to Libraries for Life has also increased in this quarter, or did increase in this quarter, reflecting the fact that the savings planned for 2021 will not be realised, as we know, due to the delay of the transfer of this service caused by the pandemic. And finally, in terms of resources and performance, the rolling annual pay bill has increased slightly more than usual this quarter due to Hertfordshire Waste Recycling Centre staff being transferred back to the County Council, as well as additional staff being taken on to cover frontline roles affected by the pandemic. As you'll see, the headcount figures have also increased due to this. Rolling annual agency spend increased slightly this quarter, but at 3.4% of the pay bill is still lower than what it was at this time last year, which was 4.3%. And finally, average sickness absence has decreased by a further 0.4 days to 5.6 days per year by this quarter. I'll leave it there and I will return my screen, but very happy to take any comments or questions.
Thank you, Alex. I'll just check on the questions. Yes, Paul Sikowski has a question.
Oh, in fact, I have four. Do you want me to go through them all? And...
Paul, why am I not surprised?
I don't know why you're not surprised. You should be surprised.
Go ahead, Paul. Put your 4 questions.
Okay, so item 6, page 174, bullet 1.1.5. It mentions that the 3 care homes that we opened in response to the COVID pandemic for transfer of patients discharged from hospitals as a kind of quarantine setup, and I just wondered if we could have perhaps a little bit of a précis really of what the situation was with those and how they've been working, because it would seem from the discussion that I had with Martin in the briefing that they appear to have worked extraordinarily well in reducing and mitigating the impact of COVID in care homes. So I just wondered if we could have a little more comment on that. Page 178 in 213, there's a rate expressed in that, and I seem to have just lost my document. Excuse me for 1 second. Page 178, there's a comment about the rate of per 10,000 population of children subject to a child protection plan, and it suggests that the rate in Hertfordshire is 15.6 per 10,000 relevant population. The next best comparable authority has a rate that's more than double that at 35.4. And the concern that I would express at that is, how can we be so much better than our nearest statistical neighbour? And whilst I don't deny that we might be that much better, I'm just concerned that it might be because we are not putting people or not putting children into child protection plans that should be in child protection plans, and I just want some reassurance that that isn't what's happening there. The next one is 5.1.5. That's relating to NEETs and the increasing rate, gradually increasing rate of young people who are not in education, employment or training. Those numbers are only likely to increase from here, given the ending of furlough in September and so on. And I just wondered what the plan is to try and reduce that. And I was wondering if we had some commentary perhaps from Scott or somebody involved in the LEP as to what that might look like. And finally, in 6.1.2, page 191, we're looking at complaints and not complaints, but queries and processing of information in relation to highways, and it suggests that performance has improved from 78 to 81%. There is a movable target listed on that, and I'm not entirely sure why, if we have a response period for public correspondence within 10 days, the target we're aiming at shouldn't be 100%. And you know, that seems a reasonable response rate. There's also a comment underneath it that the customer service centre had a turnaround time of 3 working days, and that the response times were good considering that. Well, I'm not entirely sure why that's considered good, and I would sort of question whether 4 out of 5 people getting a response within 10 days is considered a reasonable result. I think we ought to be expecting everybody to get a response within 10 days, because I'm assuming that's 10 working days. So in fact, it's in calendar days, it's 2 weeks. If we put in a request in there, I would expect a response within 10 days for anybody putting in a question or an issue with highways. And I just would like some feedback from officers about that particular scenario.
Okay. Care homes. I'm just working out who's going to be the person who's most well placed to respond to these care homes. Maybe Alex, you've got care home issues there. The context of the opening of the care homes, which enabled the transfer from hospitals before transferring them into permanent care home locations. Do you feel in a position to answer that question?
I'm happy to respond to some of the other questions, Chairman, but I do know that Martin's got some information on that he's happy to share.
Okay, Martin.
Thank you, Alex. Paul, the information I sort of picked up from colleagues over the last few hours. Yeah, these are intermediary settings dealing with urgent requests to provide accommodation and that sort of interface between hospitals and other settings and care homes. Funded through NHS monies, managed by HCC, I think was a couple of areas we were seeking clarification on. I wouldn't want to comment on success. I think that's slightly qualitative. The service certainly believes that they've fulfilled a valuable and necessary purpose. They were extremely busy in December and January, upwards of about, I think, 70 clients using those, declined significantly in February, as one might expect, given the pattern of admissions and treatments in hospital. So they are deemed, the service is currently looking at how we take this forward in terms of an increasingly important, perhaps, adjunct to our delivery services in terms of intermediary settings. There are still referrals coming through, between about 10 and 20 is the information that I've got. And there is thinking about the third wave contingency position as well. So that's part of the thinking in terms of the longer term. Hopefully that gives you some sort of feel for how it's going.
Martin, do you think you are in a position to respond to the child protection order rates, the comparisons?
Perhaps a bit of a double act with Alex on this one. It's a tricky question. When you see numbers that are so impressive, quite understandably, you think, oh, are we absolutely sure on that? Our whole safeguarding provision model, if you like, is deemed to be one of national reputation and put up by the DFE and Ofsted as a model which we, to some extent, tutor and help embed in many other authorities across the country, the transformation of children's services into that model. So one would expect our numbers and the evidence there to back it up to be both accurate and indeed reflective of the difference in the quality of the outcomes that service delivers. There's no complacency about that. So, of course, that service is inspected by Ofsted fairly regularly, deemed to be excellent. And indeed, there is an inspection coming up towards the end of the year, which will no doubt be taking a very close look at that again. So I think in answer to your question, our view is, yes, that's one would expect that degree of excellence compared to others, relative excellence, that is. But we're happy to take that back, that challenge, as it were, and just do a bit more work on that by referring it through to the Children's Services panel.
Thanks, Martin. I might just bring in Stephen Pilsworth here, because you mentioned our strategy, and one of the strategy elements that are perhaps different from other councils is our continued support for prevention strategies to keep children out of care and out of these situations. And Stephen, perhaps you could just indicate where we are in respect of the IP and that funding stream that we've been able to maintain.
it's certainly something that crops up in the discussions we have with children's services over the IP and financial planning generally, that they would be very concerned about any changes to the amount they're able to invest in prevention. So, that level has been maintained certainly for the last few years, certainly in the times I've been involved. And indeed, obviously, I gave an answer earlier in the COVID paper around some of the areas where we're actually looking to spend money. Indeed, I know that's one of the areas that Jenny Coles and her team are quite concerned about. What's the extra interventions we need to be making now to try and prevent some of the issues and uptick in, for example, children looked over that's undoubtedly due to COVID becoming permanent issues.
Thank you, Stephen. Alex, are you going to pick up the NEETs issue, or is it going to be Martin?
I think we were going to sort of hand over to Scott on this one in regards to kind of the work that's being done with the LEP and the economic recovery.
Fine, thank you. I've just spotted my note on that. So yes, Scott.
Yeah, thank you, Chair. So yeah, the LEP has been, obviously, as you'd expect, very active in this space, as have the district councils that have received funding from government for almost like direct, well, two types of funding. Some that is just about sort of direct payment in support of different sectors that have been particularly impacted by the pandemic, and then there's been more funds that have been sort of on an application basis. So the LEP's role is been sort of involved in administering a Hertfordshire economic recovery group as part of the overall strategic coordinating group structure in Hertfordshire in response to the pandemic, and as part of that, that they have the LEP have created their economic recovery strategy that's available on their website. The sorts of focus within that strategy I'll just bring them up in terms of are around the skills agenda, as we've already highlighted, and as part of that, that it's either engaging earlier with businesses now in understanding the particular challenges they've got in skill shortages, and also with actually the way that their businesses are now needing to adapt to effectively the new normal, and therefore the skills that they're going to be needing to be able to support them. So the idea is to link it through from the education sector, both in sort of further education and the universities, through to what the employers are going to need over the coming years as well, to ensure that throughput is continuing. So yeah, so there's a lot of activity. It's a bit difficult to go into all the detail here. More than happy to provide Councillor Zakowski more of an update offline.
Thank you, Scott. And I think the last item was on in relation to highway complaints. And I do recall that in the IP this year, we proposed a modest increase in the sums available for the highways team to respond to communications, etc. And I do recall that the Liberal Democrats were opposed to that. So perhaps there's a little bit of interest in the dichotomy in relation to the question. But is there anyone who, amongst Alex and Martin, who wants to report on the issue in relation to the targets and the outcomes, or is that perhaps something that ought to be taken up in the highways team?
I'm happy to perhaps offer 3 points in response by way of explanation, observation and action. In terms of explanation, the 3 days I think that you're mentioning, Paul, I think the point there, perhaps not well made, is that of the 10 days that they've got, 3 of them can be lost, as it were, because it's got to get to them. I think that's what's behind that. I didn't quite understand that, but that's what that is. By way of observation, it does make little sense, doesn't it, to have a target that moves. And I think the honest truth there is that merely reflects historical patterns, and that's not what a target should be about. So by way of action, I think more of a broader piece of work for the next performance report, particularly sort of as we move out of COVID or beginning to approach new normals to look across the piece about targets anyway, which we do as an ongoing process, but I think it's got a particular focus just to look whether we need to rebase, rephrase some of these targets, and we'll pick this up as part of that broader process.
Thank you, Martin. Sharon, you have a question.
Thank you, Chair. I've got a couple of questions on this report. The first one relates back to the earlier discussion we had on COVID, I think, partially, and that is that we've seen, we certainly see it in the health service, but I think local authorities have to have a think about this as well. There will be an element of repressed demand across our services, whether that's in safeguarding, mental health, CAMS services and things like that, or even in road traffic accidents and those sorts of things where we may have increased highway as people. Mind you, you haven't seen much decrease in traffic as far as I can see, but there may be an increase in RTCs and so on as the economy starts to get moving again. So my first question was, has there been a consideration around a comprehensive assessment of what that repressed demand might be? I know it's a bit of a finger in the air job, but it might, for financial purposes, be worth having a look at it across our services to see what is likely to occur. Second question was around agency spend, which is set out in 812 of the report. It's now, I know it's only gone up slightly in this quarter, but it is around £9.6 million worth of funding spent on agency spend. And I wondered if you would consider us having a closer look at that, Chair, on this committee. And my last point is around the risk section of the report on page 180 under 2.2, and particularly risk CSC3, where we have seen a continuing difficulty all through this year, and it was last year as well, around placements for young people with complex and challenging behaviours. And this is particularly live to me at the moment because I've been dealing with a piece of casework which relates to this. We see some of those placements costing thousands of pounds a week if we have to seek external placements for these young people. I know that some action's been taken by Children's Services in terms of building units in Hertfordshire, but we're still getting this flagged up as a red risk. So is there more that needs to be done, both to provide appropriate placements for these young people, but also to reduce the cost of them? Thank you.
Thanks, Sharon. I think your first question in relation to the suppressed demand, I'm going to ask Stephen Billsworth if he might address this. I know that there has been significant assessment within the service departments in respect of what they consider to be the potential suppressed demand coming through. And I believe that we've made certain adjustments in the budgets for those occurrences in the new year. So perhaps Stephen could address that one first.
Indeed, and it was certainly one of the factors behind my earlier comments on the COVID item around our concern about the level of cost in next financial year, precisely because some of those issues we thought might have occurred by now, we're not seeing, but we still expect they will happen. So just one particular example, expecting further referrals into Children's Services for a range of issues, many of which we've touched upon this morning. We perhaps haven't seen that as the level we might have been expecting. And we think some of that is because of the second lockdown and the school closure since Christmas, because that's where a lot of the referrals come from. So again, now as schools return in the next few weeks, and indeed in the summer term, we really would expect those referrals to come through. So whilst it's very difficult to predict the scale of those and the financial implications of those, we've certainly got an estimate in for next year, and we're keeping these under constant revision, not only now, but certainly, of course, when we get into the financial year and we get into the regular monitor process. I think we'll certainly continue the sort of dual approach of a particular focus on COVID impact, as well as monitoring the rest of the council's budgets.
Thank you, Stephen. On agency spend, Sharon, I think we bring a report annually to the committee in relation to employment and includes our agency spend. But I think it's worthwhile perhaps reflecting on that a little bit more in a bit more focused way, and perhaps in the new session post our elections. That might be an issue that might come forward as a value for money review, and perhaps I could ask Alex if he'd add that to the list of opportunities that may be coming up for consideration in the future. In relation to the risks and placements for children with special needs, I think you've referred to the fact that we've sought to address hopefully many of those opportunities by bringing some of our property ownership online in county for placements within the county boundaries. I think that's probably an issue that ought to be drawn up to or put to the Children's Services panel. But I'm sure Alex will pass the comments on, and maybe they will be able to reflect on that and give an answer in relation to what other measures they are considering bringing forward. I think those were the 3 items that you brought up. Francis, you have a question.
Yes, I do. It follows on the comment. Sorry, the computer screen slipped. It follows on the comment about the COVID-specific care homes that have been opened, and the suggestion that there should be an evaluation of their effectiveness. Now, those are my words. One of them was in my division, and yes, the demand to use the provision there was quite a slow start, and people were saying to me, well, was that a waste of money? My goodness me, it got pretty full as the peak approached, and the objective was twofold: to save lives, let's be blunt, and at the same time to free up beds in Watford General, because Watford General, as we know, has been under unbelievable pressure, and it has managed extremely well. So officers, I will float this one to you. Are you going to be evaluating it in terms of, well, there were some spare beds at some time. Thank goodness we weren't at capacity. There were quite a lot of spare beds at some time. Thank goodness, because that's what emergency provision is all about. And Hertfordshire County Council has done a brilliant job in staying ahead of the game, anticipating the problems, ensuring that we can work with the NHS, bluntly, to help save lives. So well done, County Council, and officers. I look forward to your description on how you're going to evaluate the success of a facility which has been really, really well used, has generated huge voluntary support and local support, and has undoubtedly saved lives. But you can't measure how many lives it's saved.
Okay, thank you, Francis. I recall that those the two care homes that were mothballed some time ago and then were available for us to bring back into service were part of our estate at the time, and I think the position from Adult Social Care was that they weren't keen on disposing of those two sites at the time because of their potential use in the future, either as new homes for rebuilding or, as it turned out, refurbishment in a short space of time. Just shows how the estate, the council's estate, is used in many ways to benefit the residents of Hertfordshire. Okay, I don't see any other questions. I'm going to ask you if you would vote on the recommendations under item 6, which are on the order sheet. If you'd indicate your support or otherwise for them in the chat line, please. I think we've got enough agrees on that to move forward. Yes, I think that's confirmed. Okay, we're moving on to item 7, which is the Resources and Performance Monitor Q3, and I think Alex is presenting this.
Chair, just to remind you, I think it was in the chat just for everyone's benefit. If they wanted a short break.
I must apologise. Yes, I haven't been looking at the clock, and we've done a couple of hours. So before we move on to the next item, should we take a 10-minute break? Give everybody a chance to stretch their legs and do what they need to. So we'll be back at it's 12:09 now. So let's be back at 12:20 to move on. Welcome back, everyone. We were at item 6 and moving on to item 7 of the agenda, which is the Herts County Council Resources and Performance Monitor Q3. And I believe that Alex is going to present this item.
Thank you, Chairman. As you say, this is the Q3 performance monitor for the resources and performance portfolio. So as with the overall performance monitor, also covering the period between October and December of last year. As ever, I've picked out a few highlights, but obviously I'm happy to take any comments and questions on the entirety of the report. So in terms of human resources, as mentioned in the overall monitor, we've seen the overall council and total pay bill increase in Q3. In resources, the total pay bill did also increase by 0.6 million, but in this case, this was primarily due to backdated pay awards rather than some of the broader issues I previously mentioned. In assurance, the number of fraud referrals has increased this quarter after numbers had dropped down earlier during the pandemic. This followed a short awareness campaign that was run in the late summer. There was an increase this quarter in the number of notifiable health and safety incidents, perhaps in response to more activity being allowed at times this quarter, but worth being aware that overall figures remain below those of the year before. In terms of property, income for both Ablesmith House and the rural estates remain in line with the profiled target for the financial year. Hertfordshire Development Centre has been closed for much of the year due to the pandemic, and as a result, the income target for this year has now been put on hold. In technology, the availability of IT systems for Platinum applications was 100% in Q3, but there were a couple of incidents experienced with SAP this quarter, as outlined in section 4.1.3. Legal, democratic and statutory services, both subject access requests and freedom of information requests met their timescales this quarter, hitting the 100% target. The income in registration services is, as we perhaps would expect, is still being impacted by the pandemic, as is the timeliness of coroner's inquests, with this having increased to an average of 29 weeks from the date of death to inquest hearing from 20 weeks last quarter, and perhaps expected to continue to rise as this service continues to be impacted by the pandemic, but also in terms of showing some of the implications of having to suspend these inquests earlier in the period. Community engagement, performance for average call wait time at the customer service centre increased slightly this quarter, so wait times reduced to 27 seconds, which was, as I say, is a reduction from Q2, albeit this remains still above target. The report does provide more detail on the reasons why, which include issues with telephone system performance, erratic and unpredictable call patterns, and also some staffing issues, and also says a bit more hopefully about the planned mitigation measures as well. The average multimedia score significantly increased this quarter, with highlights including significant positive coverage of the rollout of Hertfordshire's family safeguarding model and widespread coverage of the council's COVID-19 campaign messages. As we've mentioned previously, clearly there was the November lockdown and the subsequent tier changes during this period, all which had to be clearly communicated in the appropriate way. That's where I'll leave it, but very happy as ever to take any comments or questions.
Thank you, Alex. Adam Mitchell has a question.
You're on mute, Adam.
Sorry, yeah, that's fine. I'm looking at 6.1.4, which is about the Update Me email bulletins. And I noticed that the number of subscribers has fallen, and that to me seems like a very strange result, given that we're trying to get information to our residents in a time of a COVID pandemic and actually on the way out of that pandemic as well. It just seems like quite a strange result. One of the reasons given states that that we're sending coronavirus updates to everybody who's asked for anything, and that might be leading to unsubscribers, and I wasn't quite sure if that's evidenced, and maybe you can give a bit more background about that. But also I'm asking, what are we doing to promote this service, which is a good service, I use it myself, and I just wonder, are we telling people that this service actually exists so that they can subscribe to it? Thank you.
Thank you. I'll respond if I may, Chair. Certainly in terms of the reduction in subscribers, Adam, that is certainly kind of the response we've received from comms, is that clearly people sign up to receive news on certain items, but for, I think, kind of good reason, and indeed I think kind of positive results, they felt from a comms perspective they should be trying to use those mechanisms as much as possible to get COVID campaigns out. They do feel that some of those kind of unsubscribing, however, has been because they haven't signed up to get that information, and dare I say also perhaps some people feeling they've got some COVID fatigue as well. That's kind of the explanation I've received. Very happy to kind of see, once again, a fair challenge to see what evidence they've got further to sort of evidence that. So I'm happy to look into that and feed that back to you. And in terms of communications, I know that kind of the Update Me is communicated through their various channels in different ways, but once again, I can get a bit more information on that for you if that's helpful.
Yeah, I suppose what I'm asking is, obviously, we want more people to use this service, but we can't use the service itself to get more people involved. We have to get to them in other ways in order for them to know about this service. So I just wondered what sort of things we're doing to sort of promote this service.
Yeah, and certainly it's promoted on the website, as I understand it, also promoted through our publications and through our social media channels, but I can get some more information on that for you.
Thank you, Alex.
Thank you.
Paul Sikowski, you have a question.
Yeah, it's somewhat of an observation, and one that I think perhaps yourself, Ralph, might want to comment on, because I note that the fundamentals of the report as presented are that there are increasing workloads and increasing pressure on both the public and back office aspects of resources and performance. So we've seen, for example, the pay bill increasing, therefore HR requirements going to be increasing as we move forward, and as we take people on to deal with things like the COVID stuff, there is an expectation that will continue. The headcount may well continue to increase over the next 12 months. We've seen, the pressure on the coroner's service and so on, that Alex outlined, and yet the resources and performance portfolio is one that's identified in the IP as ones that we can leverage significant savings from in the next couple of years. And I just wondered whether there is some disjoint there in a service that is going to see significant increases in pressures that we perhaps couldn't have foreseen 12 months ago, that we're now expecting to leverage savings out of in the coming year to 2 years. And I just wondered about whether there is a disjoint there.
Okay, thank you, Paul. I think it's a very fair comment. I'll make some remarks, but I'm going to ask Scott if he would like to come in and reference your specific question. But I think the members of the officers' corps in the county council have worked tremendously hard over the last 12 months and have gone beyond what we might have expected from them to achieve the outcomes that we have this year. There's a lot of fatigue and so forth within the organisation, and I know that Scott is very acutely aware of that. And where we have opportunities to do so, we are seeking to relieve some of that stress and fatigue in ways of allowing people to take leave, etc., appropriately to do so. But I think the overall position from resources is that we are able to contribute to the savings of the organisation by working more effectively and efficiently and changing our work practices. But I'm sure Scott will be able to give you some information in relation to what would appear to be a dichotomy, but I'm not sure it is.
Yeah, thank you, Chair. Look, my simple answer to this is the importance of clear prioritisation, and we have a work programme within obviously from a resources perspective, a number of key projects we have to deliver to keep us compliant with legislation, improve customer services, etc. But then there's the wider role that we play in supporting change within the organisation as well, and then we need to focus and balance those priorities between the support, as in support services that we're providing to the organisation, and those of the work that we need to do ourselves. Councillor Sainsbury is exactly right in the sense that we have, in some ways, that we've had to be quite hard with staff because their general sort of natural sort of feeling in a time of emergency is doing absolutely everything they can to support the cause. But what we're finding is that people are becoming fatigued and need the break from work on the laptops and the front line. And so therefore we've been quite sort of hard in relation to making sure that people do take their leave allocations this year. As far as the issue of balancing that off in relation to a savings program that we need to deliver in resources, as I said, is that I'm being quite sort of tough with my SMB colleagues to be absolutely clear about what the priority areas for our focus are over the next year or two. As far as I'm concerned, the recovery strategy for the organisation that is just that there's going to be some discussions with our cabinet informally over the next week or so to start to shape what that recovery strategy looks like, and through that we need to prioritise as well. And once I'm clearer about that, I'm more than confident that the savings programs, which primarily within resources are focused on the transformation of services, applying new technology to what things that we've done previously that have been more manual, to be able to, and then looking at the ways of reducing waste within the system and the way that we work, rather than, I would suggest, we're not making people redundant through these programs. It's more about the efficiency that we can in the processes and the costs that come from that.
Thank you, Scott. Eric, you have a question.
Thank you, Chairman. Yeah, I'm not necessarily expecting anyone to have an answer to this, but I was just curious about the increase in birth registrations. I'm assuming that planned pregnancies, people were reluctant to go into hospitals and delayed, and I wondered whether there would be an increase in home births. As I say, I don't necessarily expect you to have the answer to that. I was just curious as to what the difference was.
We may be straying into some areas where we need to be delicately answering the question here. Alex, is there anything that you would like to venture forth on this one?
Well, I think if I'm correct in sort of identifying the area you're looking at, it's more around channel shift, so the use of kind of online services to register births as opposed to overall numbers of birth registrations. So it's a percentage of birth registrations that are done on using online systems. So I think that's kind of where that is. I suppose that does fit more broadly in terms of what we perhaps would expect given the current situations and the pandemic. But I don't know if Martin's got anything further to say more about the broader demographic kind of issues here.
Absolutely not. I'm not commenting on that at all.
Well, actually, you've answered my question because I had no idea what that meant. So thank you.
Very good. Okay, I think we've skirted around that one reasonably well. I don't see any further questions being raised. So I'm turning to the order sheet under item 7, which has got 3 items of recommendation. I'm not going to read them. Everybody can pick them up off their order sheets. Could I ask you to indicate in chat whether you support or otherwise those 3 recommendations? Thank you. I think we have an agreement on those. Moving on to, thank you, gentlemen. Moving on to item 8, the land at Harpenden Road, St Albans, a request for spend to achieve funds on this project. and it would appear that Niall Barker or James Barber are going to be presenting. I'm not sure which one it is.
Apologies, Chair, it's actually me, Sas Pedro.
Ah, okay.
Are you content for me to continue? Yeah.
Absolutely.
Thank you. So this is the paper's entitled Land at Harpenden Road, St Albans, Request for Spend to Achieve Funds. So what we're doing here is we're seeking to use our spend to achieve budget of up to 5.3 million to construct a purpose-built facility to re-provide the current services that are available on site at Land at Harpenden Road. And this will enable us to redevelop the remainder of the site. The plan is, if you were to look at the site outline plan in your appendices, that the current youth facilities are located in the centre of the development site, which makes the redevelopment of the remainder of the site very challenging. The building itself is at end of operational life, so we need to re-provide this, and this development offers us the opportunity to do that and to relocate it to the edge of the site, thus freeing up the remainder of the site for a residential development. The site itself was, for those of you who are aware of the site, is a former Ariston Works, and it does have some quite unique ground conditions that we need to be mindful of in terms of the development, both in terms of chalk mining and clay pits that were located on the site. We did commission a survey of the entire site, and we are confident that we're now aware of where these hotspots lie within the site, and so we're able to undertake the development sensitively, bearing in mind that we have these abnormal ground conditions. The site itself was declared surplus to be disposed of, and that was subject to the re-provision of those statutory services which must remain on site. That was confirmed by the local planning authority as well. We are going to provide a like-for-like replacement with some enhancements of what's available on site currently. And we've been working closely with those services affected, so our Youth Connection services and Pioneer Youth Club. And we're also looking to put in a discrete touchdown to support some of the children's services officers that work closely with the community in that area. The site was within the initial options agreement with Chalkdean, and we have two options for the redevelopment of the youth services. One is either via Chalkdean or secondary via my development and control capital delivery team within property. The recommendations in section 3 I will take as read, but please come back to me if you have any questions or want any clarification on those. In terms of the reasons why we need to provide this service, it's seen as essential to the local community. It provides locality-based youth work services and runs group projects and programmes. It works with groups of young people, but also does intensive one-to-one work with young people referred from other services. It's a safe, appropriate, well-equipped space, and one that we're looking to re-provide, as I said, like for like, but also building on enhancing it in terms of the facilities. And it is seen as a local hub within the area for a wide range of services for young people, and it has had lots of positive outcomes in terms of improving life chances for those young people at risk. In terms of our conversations with St Albans District Council, they have been positive, and they've indicated that they see that the re-provision of these community facilities as integral to any redevelopment of the site. Legal implications, none other than via the lease agreements that we will set up with the trustees of the Pioneer Club, and we're already in negotiation with them around what the provision needs to look like in terms of design and also in terms of the rental agreements going forward. We had considered other options, but this was considered the most viable and the best for the community. And that concludes my presentation, Chair. Thank you.
Thank you, Sas. There is a part 2 to this report, but there are no recommendations in the part 2. So unless anybody has a question relating to the part 2. I'm not proposing to move into part 2, but we'll see how that turns out. I think, Paul, you have the first question.
Thank you. I think Sas has touched on both the concerns that I wanted to express. The first was just to reiterate and confirm the re-provision of all the current services on the site, and that was, I think, for the community is a very critical thing, because there had been discussions about whether they could be re-provided elsewhere in the wider St Albans, and of course that would adversely impact the immediately local community in a way that they felt would be very detrimental. So it's really pleasing to hear that the re-provision will be on site. The point that I would actually like to focus on, however, is the ground conditions question. You mentioned that there'd been a survey and that it had identified a number of what you described as hotspots. And I'm not entirely sure what you precisely mean by that, because my understanding of the geology of the area is that you're talking about chalk mining through use of probably bell pits or similar. So there may be unrecognised underground cavities that could result in subsidence or subsequent collapse in particular locations. Now, is the hotspots that you're describing those cavities? Are there actually cavities that are acknowledged on the site? And you know, what is our exposure? And I think this is the relevant point for this panel. What is our exposure if one of those cavities subsequently transpires to affect one of the buildings we are subsequently intending to put up? The exposure really being a financial one, because I know that grouting to fill some of those cavities to enable buildings to be constructed on top can be inordinately expensive. I mean, tens of millions of pounds expensive, and the kind of price that we see happened in terms of the grouting needed in Fontmell Close. So I just wanted a bit more expansion really on the survey that was done, how comprehensive that was, and how certain we are that the money that we're proposing to put in there, it isn't going to be the start of a spiral in terms of funding costs. So if you could reassure me on that point particularly, I'd appreciate it.
Sas.
Thank you, Chair. As you know, we commissioned the survey in 2017, and it was a survey that was quite intrusive and went to look at the particular issues related to the chalk mining and clay pits that were on site. It surveyed the entire area of the former works, which is the development area, and also the adjoining field, which we have reserved for a future school site. It identified hotspots, and what I mean by hotspots is where sinkholes could appear, where there is a risk of them appearing, precisely what you're saying, Councillor. And what we're doing is we're counteracting any issue of this nature by a mixture of suitable foundation designs with experienced contractors that understand the geology and the issues related to the site, and also the layout of the site. So we're avoiding or skirting around the hotspot areas. We are reassured through specialist consultancy works that we've got this matter fully under control, and that any problems and we can tackle any problems, at source, so we don't have resulting problems later down the line. And they are being fully costed now ahead of committing any significant expenditure. And we're working with Chalkdean, who are looking to redevelop the remainder of the site to make sure that we have a collaborative approach to site development.
Thank you. I don't see any other questions being asked. Can I take it that no one particularly wants to move into part 2 to discuss items in the part 2 agenda? As I said, there is no decisions to be made in part 2. So if we move to the recommendations on the order sheet, which are numbered 1 to 4, I'm not going to read them. They're quite lengthy. Could I ask everybody if they would indicate in the chat function whether they agree or otherwise to those recommendations, please? Okay, I think we have a confirmation that that's been agreed. Thank you, Sas. Sas, are you going to be doing the next one as well, or someone else?
I'm deferring to Andrew Edwards, one of my officers, for the next item. But I will remain online, so I'm available for any further questions.
Okay. Item 9 is the disposal of land south of Haddam Road, Bishop Stortford. This does have a part 2, which we will have to go into because there is a recommendation in the part 2 report. But we'll deal with the part 1 report first. And Andrew, you are presenting.
You're muted, Andrew.
My apologies. Andrew Edwards, I'm a senior estates officer in the property department. The part 1 paper is really a very simple exposition of the position, where we have a site of 6 odd acres of residential land. There is an opportunity, and it is only a window of opportunity, where we can sell the site, realise the receipt for it within a matter of 2 to 3 months. It's a window which might close within that period, and therefore we must move quickly in order to take advantage of it. The detail of the proposal is essentially all in part 2. So rather than trying to confuse myself with what's part 1 and part 2, may I leave the first part of the presentation there.
Okay, thank you, Andrew. Are there anyone like to ask a question in relation to the part 1, or would you prefer to hold on and ask your questions in part 2? I can't see anybody deferring from that. So, Elaine, can I ask the meeting if it's prepared to move into part 2? And I'm assuming that unless I see anybody saying they would prefer not to, that we are agreed to move into part 2. Elaine, could you confirm that we've dried up the live stream?
Yep, just give us a moment, please, Chairman. We're live, Chairman.
Thank you very much. The recommendations in part 2 were approved, and I'm now returning to part 1 and asking the panel to indicate their approval or otherwise to the recommendations in the part 1 report. Can I ask you if you'd indicate in chat, please, agreement or otherwise? I think we've had confirmation that that's agreed. And that concludes the items on the agenda for today's meeting. Thank you all for your attention and deliberations. We will all meet again, I've no doubt, at another meeting in the future. Thank you all. Thank you all the officers for their reports and so forth. And I think good afternoon.
Thank you, Ralph.
Thank you.
Yeah. Thanks, everyone.
Thank you.
Thank you.
Bye.
Bye.